Everyone, today we are going to study cryotherapy. Cryotherapy is or ice therapy is the application of cold to the body tissue after an injury. It is one of the old medicine itself. Nowadays, local cold application may be applied by the use of various forms of ice or frozen gel packs or by evaporating of volatile fluids from the skin. Often, skin temperatures reduces to 10 degrees centigrade. So, cryotherapy is the application of cold to the body tissues after injury. Is the cryotherapy. Cryotherapy refers to the use of local or general body cooling for the therapeutic purposes. Local cooling is achieved through many ways, such as blowing cold air on the skin or using evaporating sprays or crushed ice, the most common used method. In this, temperature of the treatment area or treated area is transferred from the skin to the ice through conduction or convection method. Now next is the factors affecting tissue cooling. What are the factors? Factors related to the application of technique are: number A is the temperature difference between the skin and the coolant. Like example, ice which is 0 degree centigrade produces fastest tissue cooling. Next, number 2 is the cold water which is 10 degrees centigrade produces faster cooling than the cold air which is 20 degrees centigrade. Number B, thermal conductivity of the coolant. Ice packs have heavier thermal conductivity than water and produces faster tissue cooling. Number C is the presence of barriers between the coolant and the skin, like wrapping of ice packs in towels produces slower cooling. Number 2, direct contact of ice with skin produces faster cooling. Number D, length of application time is the longer the time of application of ice, the more temperature drops it produces. Okay. And number 2, factors as related to the treatment tissue. In this, number A is the vascularity of the tissue. Here the vascularity, when there is higher vascularity, produces slower tissue cooling. Number 2 is the muscles need more time to cool down. Number 3 is the tendons and ligaments cool down quickly. Number B is the thermal conductivity of the tissue. Here the muscles, which is water filled tissue, have the higher conductivity than the fat and skin. Number C is the size of the treated area. The larger the size of application area, the more energy lost and faster cooling occurs. Number D is the depth of the tissue. Or targeted tissue is the superficial tissue cool down quickly and the deep tissue needs more time to cool down. Now, what are the physical principles of cryotherapy? When ice is applied to the skin, the heat is conducted from the skin to the ice in order to melt it. Next point is the to change its states. The ice requires considerable energy that is known as the latent heat of fusion. You heard about the latent heat in the physics chapter. To change its states from ice, it requires considerable energy which is known as the latent heat of fusion. Next point is the specific amount of energy required to change the solid form of some particular substance into a liquid or liquid into a gas. This energy is called a latent heat. So what is latent heat? One of the short question comes from the latent heat. It is the specific amount of energy required to change the solid form of the particular substance into a liquid or the liquid into a gas. This energy is called a latent heat and is the energy required to change the states. Okay. And next one is what are the factors affecting the heat loss? The temperature changes in the tissue will depend on both the rate and amount of heat energy removed. Next is the colder the application of the greater the heat loss from the tissue is greater. In general, water-filled tissues such as muscle have the higher thermal conductivity compared to the fat one. The larger the area, the more heat energy is lost. Okay. Next is the physiological effect of cold application. What is the physiological effect? Number one is the circulatory response. The initial skin reaction to cooling is an attempt to preserve heat. It is accomplished by an initial vasoconstriction. So, what occurs? At first, when you apply the ice to the skin, initially it occurs vasoconstriction. Then, this hemostatic response has the effect of cooling of the body part. Okay. Next one, after a short period of time, the duration depends on the area involved. A vasodilatation follows with alternating periods of constriction and dilatation. This alternating period of constriction and dilatation, this reaction of hunting for a mean point of circulation is called the Lewis-Hunting reaction. On short notes comes from the Lewis-Hunting reaction. Okay, you have to write the whole thing. Initially vasoconstriction, then vasodilatation, and occurs. Time depends. During the vasodilatation, the arteriovenous anastomosis is closed, thus causing an increased blood flow through the capillaries. This is beneficial in the treatment of swelling and tissue damage. So, this is the Lewis-Hunting reaction. Initially, you can see. Initially, you can see here a vasoconstriction occurs, then vasodilatation and constriction, dilatation, constriction, dilatation, constriction, and this occurs on. This is the time frame, and this is the vasoconstriction here and vasodilatation here. You are applying cooling normal range here. At first, vasoconstriction occur, then vasodilatation, constriction, dilatation, constriction, dilatation. So, Hunting response reflects increase in vasodilatation that occurs in response to the cold. Okay, approximately 15 minutes into the treatment. Okay, so this is the circulatory response which has the Lewis-Hunting reaction. Next, physiological effect of cold application on the cutaneous blood vessels. There is immediate vasoconstriction of the cutaneous blood vessels and skin blanching. This vasoconstriction occurs so rapidly which decreases blood flow to the skin. The decreased blood flow decreases heat loss from the body. Thus, the vasoconstriction starts by stimulation of the cold thermoreceptor, which results in contraction of the smooth muscle of the blood vessels, which is a direct effect. Next one is the stimulation of sympathetic nervous system, which produce contraction of the smooth muscles of the blood vessels. Number 3 is the decreasing the release of histamine-like substance. Okay, the number A point was the vasoconstriction. Number B is the increased blood viscosity. Number C is the decreased blood flow, which is produced by vasoconstriction and increased blood viscosity. You already know D point is the Lewis-Hunting reaction. You can add some point from the previous one. The ice application for long time produces a Hunting response of Lewis. Hunting response of Lewis occurs when the body temperature is warm, and the cold application is applied to the small area of the body. Okay, the initial vasoconstriction is converted into a marked vasodilatation in two cases after 10 to 15 minutes of cold application. When and number 2 is the when tissue temperature drops below 10 degree centigrade. The vasodilatation will last for other than 10 to 15 minutes. Then vasoconstriction occurs again and lasts for another 10 to 15 minutes. Okay. The next number 2 point of the physiological effect is on the muscle blood flow. Cryotherapy decreases muscle blood flow, but it needs more time than that needed for the skin. Okay. The cryotherapy produces vasoconstriction and slowing of blood flow in the muscles within 18 minutes of applications. the blood flow of muscles under cryotherapy application is decreased, as well as the same muscle on contralateral side. Okay. Number D is the muscle rewarming takes long time after reaching the maximum cooling. Here is the schematic diagram where the temperature in the midpoint, temperature. Here is the vasodilator, which vasodilator are the histamine and prostaglandin and the cutaneous thermoreceptors. And temperature direct affect the blood viscosity, which increases. Thus, blood viscosity, after the blood viscosity increases, the blood flow decreases, which is inversely proportional. On the cutaneous thermoreceptor, it occurs on two phases of the smooth muscle contraction and spinal cord dorsal root ganglion. Here, the smooth muscle contraction occurs also the vasoconstriction, and the vasodilator also occurs vasoconstriction. And next one is the spinal cord dorsal root ganglion, which is the sympathetic, increase the sympathetic adrenergic activation. Okay. This one is the mechanism of reduction of blood flow in response to the cold application. Number 3 is on the metabolic rate. With acute trauma, tissue damage occurs due to the trauma itself. Secondary tissue hypoxia and inflammatory enzymatic activity increases. Ice application decreases metabolic rate to the cool tissue by 13% for every 1 degree temperature drop in skin temperature, which reduces the need of oxygenated blood. Number C is the hyperemia due to cooling, not beneficial for tissue healing. This on the metabolic rate. The principal effect of cooling living tissue will be to reduce this metabolic rate in accordance to Van't law. The application of physiological application of cold on the metabolic rate is used by the Van't law. Okay, this is known as the Van't law. It states that the rate of any chemical action that can be affected in increase or decreased by a temperature or rise fall. The metabolism, being a series of chemical reactions, will decrease with the fall of temperature. The actual change is about 1/8 for 1 degree temperature. Okay. Number 4 is the neural response or peripheral nervous system. The skin contains primary thermoreceptors. Cold receptors are several times more numerous than the warm receptor. The cold receptor responds to cooling by a sustained discharge of impulse, the rate of which increases with further cooling. The rate of contraction of nerve fibers in a mixed or motor or sensory peripheral nerves is reduced by cooling. The first fibers affected by gradual cooling are the A fibers, which are myelinated, and eventually at very low temperature the B and C fibers, which are non-myelinated, are affected. Next is the synaptic transmission can also be delayed. This effect is helpful in treating pain and hypertonicity. Next one is the on motor system, the physiological effect of cooling. The muscle strength is seen to diminish on cooling the limb in water at 10 to 15 degrees centigrade, probably because of its effects on viscosity and metabolic rate. Next one, what there is evidence that the strength increases over the original value about an hour after the cooling. Another one is the motor system is the brief icing for short time stimulates skin receptors which facilitate muscle contraction, increase the force of isometric contraction, increases muscle endurance, and which are the effect of brief icing or short time icing. And the prolonged icing more than 30 minutes, which decreases muscle force, occurs with cooling in 10 to 15 degree temperature water for 30 minutes. It produces decreased blood flow and decreased nerve conduction velocity. When the muscle rewarms within 1 hour of application, the muscle force again increases. Okay. Next one is the decreased speed and accuracy of motor skill. Third one is the reduced muscle spasm. Fourth one is the reduction of spasticity. Okay. So these are the physiological physiological effects of cold application or cryotherapy. Okay, next one is the therapeutic effects of cold or cryotherapy, which is the decreased bleeding in recent injuries. Number one is the decreased bleeding in recent injury. Under this heading, subheading A, it is the decreased blood flow and increased blood viscosity which decreases bleeding in the skin and muscles. Okay. Number B is it requires long application time. Number 2 is the decreased tissue damage caused by the injury or burn through. Number A is the decreasing metabolic through the decreasing metabolic rate, and number B is the slowing the inflammatory process. Number 3 is the reduced edema, decreased production of histamine like substances and decreased circulation and blood flow. Number 4 is the relief pain. This occurs due to reduction of edema, decreased release of histamine like substance, decreased nerve conduction velocity, and number 2 is the skin stimulation. Reduce muscle spasm by reducing pain, edema, inflammation. Reduce spasticity by using prolonged icing. And number 7 is the facilitate muscle contraction by using brief icing. Okay. In other words, these are the uses or therapeutic effect of ice therapy: reduce pain, reduce spasticity, reduce muscle spasm, reduce swelling, promote repair to the damaged tissue, provide excitatory stimulus to the inhibited muscles, which muscles are inhibited due to any cause, and used in strength training. Number 1 is the reduction of pain. Pain reduction is one of the most major effect of ice application, which has been used for many years. The probable mechanism is that by the stimulation of cold receptors, impulses will be sent back, which will pass into the posterior root of the spinal cord. These impulses arriving through large diameter nerves effectively block out of any other the impulses attempting to access the spinal cord. This reduces the pain temporarily. For permanent pain relief, positive physiotherapy just like strengthening mobilization has to be given during this period. And number 2 is the reduction of spasticity. What is spasticity? Which is the pathological state of increased muscle tone resulting from damage to the upper motor neurons. The small anterior horn cell from the higher control of extrapyramidal system and fires spontaneously at an increased rate. The net result of this ultimately to increase tone in the extrafusal muscle fiber with the hypertonic spastic state appears. And what is spasm? It is a normal response to injury or pain and is manifested as an increase in muscle tone in a specific area with the apparent aim of limiting the movement and the further damage. However, the amount of spasm is often exceeding and the sustained contraction of muscles will in return start to produce pain, often resulting then in more spasm. The mechanism by which cold reduces spasticity and spasm are probably the reduced velocity of the nerve conduction and the depressed sensitivity of the receptor. Okay. Next one are the indications of cryotherapy. The acute pain, chronic pain, acute swelling, controlling hemorrhage and edema, myofascial trigger points, muscle guarding, muscle spasm, acute muscle strain, acute ligament sprain, acute contusion, bursitis, tenosynovitis, tendinitis, delayed onset muscle soreness or DOMS. Okay. Extra are the burns and pressures ulcer. Extra indications are the burns and pressure ulcer and the rehabilitation of neurological conditions, such neurological condition and muscle re-education. Okay. Now the contraindication. It is the unreliable patient, loss of sensation, analgesic drug, patient receiving deep X-ray therapy, ischemia and poor circulation, neoplasm and severe cardiac condition and eye sensitivity. Another contraindications are impaired circulations, just in case of Raynaud's disease or Raynaud's phenomenon, and peripheral vascular disease such as DVT, hypersensitivity to cold, skill anesthesia, open wound or skin conditions such as cold purple or contrast bath and infection. Cold urticaria, another one. COLD, cold urticaria, URTICRIA. Cold urticaria is another condition which is contraindicated. In the next chapter, we'll study about the technique of application of cryotherapy. Okay, in the next video, I will study it, the technique of application of cryotherapy, along with the cryostretching. Okay, cryostretching and the excitatory cold method. Okay, thank you.